Okay, I want to wrap up this chapter PowerPoint with this video. And then our next video will cover the last two handouts. What I want to mention in this video are two things that are caused by lack of blood flow. So the blood vessels' inability to move blood properly can lead to these two things. The first one is called syncope. And syncope is kind of an interesting thing. We know it commonly as fainting. So it says carotid sinus massage can slow our heart and prevent tachycardia. That's a fast heart rate. So tachycardia just means an overly quick heartbeat. So if we massage our carotid arteries in a specific way, we can lower the heart rate. So it says this is careful neck massage or stimulation over the carotid sinus. It's going to lower our heart rate. It can actually cause someone to pass out. And so anything that is putting pressure on the neck, let's say you have a tight collar on, or you've injured yourself, or someone is squeezing you. I always think of Spock's, I don't want to call it a death grip, but his thing that he does when he grabs a person's shoulder and makes them pass out. That would be a carotid sinus massage. So if you put on a tight collar or something like that, you may actually pass out. It can slow the heart rate and cause lack of blood flow to the brain, which causes you to lose consciousness. Now, syncope or fainting, we want to make sure that you understand that syncope is just a fancy word for fainting, right? So fainting is a sudden temporary loss of consciousness. And it's not due to some underlying factor. It's not due to any trauma or injury. It's just a temporary loss due to some other problem. Now, there are several different types of syncope. All right, so syncope causes what we know as cerebral ischemia. Ischemia just means a lack of blood to the brain, or to any other part of the body for that matter. Now, the causes of syncope vary. So we have different types. The first one is called vasodepressor syncope. Vasodepressor syncope is due to emotion. Have you ever been so emotional that you feel like you're going to pass out? That is what we call vasodepressor syncope. The second one is called situational syncope. Situational syncope, it says pressure, stress due to coughing, defecating, urinating, or laughing. Now, I've actually had situational syncope through laughing. Have you ever laughed so hard you felt like you were gonna pass out? I've done that actually. Maybe it's a little embarrassing to admit, but I like to watch fail videos on YouTube, and there was this one in particular I remember. It's this guy carrying coffee, and he's on a skateboard, and he's skateboarding along, and he gives this guy a high five. And when he gives the guy a high five, he just falls and spills his coffee, and he's all pissed off. And for some reason, I was watching that video one time, and it just made me laugh, and I couldn't stop laughing. I actually, it's one of those drop to the floor laughing, and I almost passed out because of situational syncope. Some of these other things, you can imagine coughing so hard that you feel like you're going to pass out. Now, I have to admit, I've never peed or pooped in a way that made me want to pass out. But I guess it can happen. So if you have any stories to tell about that, you can send them to me. That would be cool. All right. The third one is drug-induced syncope. Certain medications, vasodilators, tranquilizers, can lower the blood pressure and cause someone to pass out. And then the fourth one we've all experienced, orthostatic hypotension. That's when you stand up too fast and due to gravity, blood flow is temporarily lessened going into the brain, and you feel like you're going to pass out. That's called orthostatic hypotension. That's when you put your hands on your knees and you're trying to get blood flow back to your brain. Okay, so that's syncope. Now, I'm going to skip this slide because this is going to be our next handout. Evaluating circulation. This slide, I just want you to know what tachycardia is. Tachycardia is a higher than normal heart rate over 100. The normal heart rate would be somewhere around 70 to 80 beats per minute if you're just hanging out, like watching this video. If it's sustained over 100, that's called tachycardia. Bradycardia is a lower than normal blood beat or blood pressure or heartbeat, which is under 60. And then we should know that systolic is the part of the blood pressure where we are dealing with ventricular contraction, and diastolic is going to be ventricular relaxation. So when the ventricles contract, we call that systole, and when they relax, we call it diastole, just like in that last chapter. Okay. Blood pressure is normally 120 over 80 in a healthy young adult. So just know that number. The last thing I want to talk about is shock. If someone is going into shock, they are moving out of homeostasis. So it says it results in a failure of the cardiovascular system to deliver enough oxygen and nutrients to the body cells. That is the definition of shock. So it says as a result, cells can dysfunction, metabolism becomes abnormal, and cells can die. So shock is a very serious thing. It can cause death if not treated. Now, kind of like syncope, there's different types of shock. Hypovolemic shock is our first one. That is due to a loss of blood or body fluids. So if someone's bleeding out, they're going to go into hypovolemic shock. Hypo, under, volume. So your blood volume is lower than it needs to be. This can also be accomplished or caused by a lack of water. So over sweating, diarrhea, you can get dehydrated, and that also lowers your blood volume. So hypovolemic shock is more of a blood volume issue, whether you're losing blood or whether you're losing water. All right, so it says venous return to the heart declines, output decreases, blood pressure drops. Then we have cardiogenic shock. Cardiogenic shock is caused by damage to the heart. So the heart itself is damaged, maybe due to a heart attack, but this causes failure of adequate nutrient delivery to the body. Then we have vascular shock. Vascular shock is inappropriate vasodilation. So your blood vessels should dilate to regulate heart rate and blood pressure. So we can dilate our blood vessels, get them larger, so that lowers our blood pressure. If this happens inappropriately, we go into vascular shock. This is exactly what occurs when someone is going into anaphylactic shock. Anaphylactic shock is vascular shock. What happens is they have inappropriate vasodilation due to some kind of a allergic reaction, and that lowers their heart rate so much that they could possibly die. So this is a big deal. Same thing with sepsis or septic shock. Causes vasodilation. The blood vessels dilate. All of those arterioles dilate out. Blood pressure drops too much. Person can't recover from that. I should mention with vascular shock, one of the treatments for vascular shock, things like anaphylaxis, is epinephrine, adrenaline. So they give the person a big dose of adrenaline, and the adrenaline vasoconstricts those blood vessels, causes the blood pressure to rise again. Then we have obstructive shock. Obstructive shock is when there's a blockage of something, like a pulmonary embolism, which is blocking the lungs and causing failure of the cardiovascular system to deliver adequate oxygen to the body. So that is what we call obstructive shock. Okay, so we have some things that happen when a person goes into shock. We're going to activate what's called the renin-angiotensin-aldosterone reflex, which is what my last handouts are about. We can secrete antidiuretic hormone to raise the water in our blood and raise our blood pressure. We can activate the sympathetic nervous system. That sympathetic nervous system can cause the heart to beat faster, things like that. And then we can release local vasodilators to try and counteract this. So shock, it says if blood volume drops by 10 to 20%, or if our blood pressure doesn't rise, cells are going to start to die. And that can lead to death of the individual. Okay, so the symptoms of shock says rapid resting heart rate. So the person's heart's going to be beating really fast even though they're laying on the ground. They're going to have a weak rapid pulse. Because the body's trying to divert blood to the essential internal organs, blood flow is going to be reduced in the skin, making it clammy and cool. The person's going to be activating their sympathetic nervous system, so they'll be sweating. They won't be getting enough blood to the brain, so they'll have an altered mental state. And of course, they're going to be trying to retain water, so they're going to have reduced urine formation as they release aldosterone and antidiuretic hormone. They want more water in their body to get that blood pressure up, so they'll feel very thirsty as well. And they will not be getting rid of waste products adequately because their kidneys are inhibited. So they may have a buildup of acids, which is called acidosis. All right. Oh, and it says they may get nauseous because the digestive system is shutting down to keep water in our body. Okay. I'm not going to worry about the hepatic portal. Other disorders. Oh, this is worth mentioning because a lot of people have high blood pressure. So hypertension is just high blood pressure. Hypertension is our fancy word for high blood pressure. So it says someone who's got blood pressure 140 over 90 is considered high blood pressure. Now there are two types of high blood pressure. Primary high blood pressure is about 90 to 95% of all cases, and we don't know what it is. We don't know what's causing it. It's some underlying factor that cannot be identified. The person just has high blood pressure. The second type is called secondary hypertension, and that's only around 5 to 10% of the cases. And we know what's going on with that. It has something to do with our kidneys. So the kidneys are actually the organ that's going to be recognizing blood pressure and regulating it. And so with the kidneys, if they have kidney damage, kidney failure, they're going to have secondary hypertension. All right, so it says high blood pressure is serious because it can cause a lot of damage to things. It can damage blood vessels, it can damage the heart, the brain, the kidneys, the eyes, all kinds of stuff with high blood pressure. It causes edema, it can be a life-threatening thing, and it builds up over time. So it says there may be no pain or noticeable symptoms for quite a while as the hypertension is damaging different parts of the body. Okay, so that takes care of our chapter 21, except for that last handout, which I'll cover in the next video. All right, by the way, this is just my daughter when she was, I don't know, like 4 or 5 years old. She's in college now, so this is a little outdated. But her middle name is Danaeus. I just have to share this with you because it's cute. And it was an extra credit question on the test. I don't know. Maybe I'll put it on there again. But her middle name is Danaeus. It's Dana with a U-S on the end. Danaeus. And Danaeus is the genus to the monarch butterfly. Remember, I'm a butterfly scientist, so I've got her named after the monarch butterfly. All right, so I'll get to the next handout here, and then we'll be done with chapter 21. All right, have a good one.